Welcome to Long Covid Doctor, an educational series for sufferers of long Covid. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now GP lead for 3 NHS Long Covid clinics, and also a GP clinical lead in Long Covid across southwest England. So this episode is on palpitations and Long Covid. In part 1, I talk about the symptoms, diagnosis, investigations and causes. In part 2, I will talk about the treatments, management and outcomes. Check out the references, resources and links in the show notes below. Just to say, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. And so, here we go. Palpitations and Long Covid. So firstly, the context, the background. Palpitations in Long Covid are common. This is certainly my experience in the 3 Long Covid clinics I work in, usually associated with other symptoms, having a significant effect on our patients. This is usually in patients who've previously completely fit and active, running marathons, never had palpitations before. They're young with no other illnesses other than the fact that they have had and still have long Covid. And so, what are our patients actually experiencing? What are the symptoms and associated symptoms? Palpitations are an awareness of heartbeat, awareness of your heart actually beating in your chest, felt in the chest as a thudding, a thumping, a pounding, either single palpitations or runs of multiple palpitations, multiple heartbeats, lasting seconds or minutes or even hours. They can be occurring on exertion or at rest, at night. I've heard patients frequently report waking up at night with palpitations for no reason. They can occur only when they're standing or having got up from lying. They can be either regular or irregular. They may be associated with other symptoms such as breathlessness, sweating, chest pain even. There are other common associations, say anxiety, feeling of unease, feeling of doom or even fatigue, exercise intolerance, and there are often other general unconnected long Covid symptoms such as nausea, irritable bowel syndrome, headache, sleep disturbance, brain fog, temperature dysregulation, and this sort of strange, what's described as coat hanger pain, discomfort across the shoulder girdle, across both shoulders, coat hanger pain. These other more sort of general unconnected long Covid symptoms are grouped together as dysautonomic symptoms. I'll come on to that. And so, how do we go about helping? We need to get a full medical assessment first of all. To get a diagnosis, we need to take a standard history and examination to get the diagnosis. Specifically, we are looking for possible differential diagnoses, i.e. other diagnoses in which palpitations are also present. How do we go about this? Well, we need to take a thorough history and examination. Firstly, the standard detailed history, everything about the palpitations. What exactly is the patient experiencing? How often and for how long? What are the factors that make those palpitations worse, or what does the patient do to make them better? We want to know the impact of those palpitations on the patient's everyday life. We want to know any associated symptoms. We want to know any past medical history, such as heart disease. Palpitations to do with the heart. Obviously, we want to know whether there are heart problems. We want to know any current medications the patient may be taking, as well as other sort of over-the-counter drugs, medications that they have experimented with themselves. And then it's on to the examination, as guided by the symptoms and the history. We want to know the pulse rate. We want to know the pulse rhythm. So is the pulse rate at rest sort of regular or irregular? We want to check for pulse deficit, i.e. the difference between the heart rate and the pulse rate. That could be a sign of, or probably is a sign of, atrial fibrillation. We obviously want to listen to the heart, listen for murmurs. Thinking cardiovascular, we obviously want to measure the blood pressure, both sitting as well as standing. We want to be looking for other signs, such as signs of heart failure, crackles at the base of the lungs, raised jugular venous pressure, ankle swelling. Having taken the history and examination, it's then on to investigations. And these are usually done, first of all, in primary care by your family doctor, your GP. There's the Long Covid blood panel as recommended by NICE guidelines. That's the National Institute of Health Care Excellence guidelines for Long Covid. So we want to be doing the full blood count, liver function test. We want to do the kidney function test. We're going to look for inflammation, CRP and ferritin. We want to do the HbA1c. We want to measure thyroid function test. Overactive thyroid can present with palpitations. And I mentioned full blood count. Anemia, iron deficiency anemia, can present with palpitations. Other blood tests that may be relevant would be the BNP, looking for heart strain, or troponin, looking if there's chest pain as well. Also in general practice, primary care, the GP can request a chest x-ray. Again, this is obviously relevant in a patient with palpitations, looking for signs of heart failure, for example, fluid in the lung, pneumonia, or enlarged heart. Again, thinking heart, obviously we want to do a 12-lead ECG to look for hypertrophy, so swelling of the heart muscle, ischemia, look for atrial fibrillation, remembering what I was saying about the difference between the heart rate and the pulse rate. That's a diagnosis of atrial fibrillation confirmed with an ECG. We also want to look for the QT interval, the interval between the Q and the T waves in the ECG trace. Palpitations also need, anyone investigating palpitations needs to be doing a ECG over a prolonged period of time. So 24 hours, 3 days, 7-day Holter tape. This is obviously really important. This tells us how often and for how long the patient has their palpitations, and matched up with what the patient is doing at the time of their palpitations. The cardiologists, obviously, now turning to secondary care, hospital care, have a number of other investigations up their sleeve. They've got exercise testing, putting the patient on a treadmill, doing an exercise ECG or a stress echocardiogram. Echocardiogram looking for pericardial effusion. They've got coronary angiograms, they can do cardiac MRIs, they can do PET scans. Again, this is all governed by the symptoms and associated symptoms. When in doubt, a general practitioner will refer the patient on to secondary care if he is suspicious of other more serious cardiac conditions to do with the coronary arteries, say. The reason why we have to be so thorough is to look for red flags, i.e. symptoms and signs that suggest something more sinister. So what are the red flags in patients with palpitations? Well, there'll be chest pain upon exertion or whilst they're having their palpitations, feeling faint, having drop attacks, a racing heart rate at rest, acute onset, sudden onset, breathlessness or progressive breathlessness, reduced oxygen saturation or desaturation with exertion, with exercise of more than 3%. If the patient has any of those red flags, obviously the patient will be referred or should be seen, should present at the hospital. Even if there aren't any obvious red flags, but your instinct tells you that something just isn't right, just ask. If in doubt, ask. Go to your GP. This is important. The other reason why we've had to be so thorough with our assessment is to be sure that we're not being COVID blind. So what do I mean by this? So just because you have had COVID, it doesn't mean that your new problem, your new symptom, in this case palpitations, can be put down to COVID, part of your long COVID. It might be due to another unrelated cause. And as I mentioned earlier, so for example, palpitations could be due to the fact you're iron deficiency, anemia, or because your thyroid is being overactive. So there's good examples of remembering first principles, exclude other unrelated causes, unrelated to the long COVID. We mustn't be COVID blind. And so, having completed the thorough history, examination, investigations, excluded the red flags and other diagnoses, we're left with the diagnosis of palpitations that have arisen as part of the long COVID picture. But there are a number of ways that they can present in our patients with long COVID. Before I go into them, I just wanted to just mention that, basically palpitations are actually very common in the normal population, in the healthy, normal population. We all have occasional missed beats or extra beats, but we're all unaware of them. And so palpitations are not necessarily indicative of heart disorder or long COVID indeed, i.e. they are innocent and coincidental and not in need of treatment. The commonest cause of palpitations in the normal population are, there are a number of them. The commonest, I have to say, again, drawing from my experience, 30 years in general practice, excess caffeine intake, excess coffee. And remembering there is also caffeine in tea, but it's usually coffee, and particularly in this day and age of coffee culture, it's quite common. But also caffeine is in energy drinks. Other causes are stress, anxiety, panic, and as I mentioned earlier, palpitations associated with anemia and overactive thyroid. But also, you can get palpitations when you're running a temperature, when you're in the acute phase of a viral illness with a fever. And so, looking now into palpitations in general, i.e. other than those ones I've just mentioned, looking at what we see in our long COVID clinics. Basically, we see three presentations for palpitations. We see palpitations that are fast and regular. We see palpitations that are occurring irregularly at any time. And we see palpitations that are regular that are occurring upon standing from lying, i.e. getting up from the lying position to standing, or upon prolonged standing. So palpitations that are regular and fast, this is due to what we call inappropriate sinus tachycardia. Palpitations that are irregular and occurring at any time, we call these extrasystoles, or it could be due to atrial fibrillation or atrial flutter. And then finally, palpitations that are regular that have been brought on with a change of position from lying to standing or upon prolonged standing. It's due to POTS dysautonomia. So let's just turn to POTS. What is POTS and what is dysautonomia? This is a topic of another one of my presentations, but in brief, COVID can cause dysfunction of the autonomic nervous system, the automatic autonomic nervous system. Dysfunction of that autonomic nervous system, otherwise known as dysautonomia, dysfunction of the autonomic nervous system, dysautonomia, presents with orthostatic intolerance symptoms or syndromes, i.e. problems while standing up, while being stood up, one of which is POTS, postural orthostatic tachycardia syndrome. This is rapid pulse, i.e. tachycardia, upon standing from lying or prolonged standing. Other cardiological symptoms associated with POTS are breathlessness and chest pain, maybe. Other general dysautonomic symptoms associated with POTS are dizziness, fainting, brain fog, fatigue, headache, nausea. POTS is diagnosed by getting the patient to do a NASA lean test or an active stand test. So basically, the pulse and blood pressure are measured after 3 minutes lying flat, and then at 2, 5 and 10 minutes standing. So i.e. the patient is pulse blood pressure measured light, and then the patient's asked to stand, and the pulse blood pressure are measured at those time intervals. You are diagnosed with POTS if your pulse increases by more than 30 beats per minute at 10 minutes standing or thereabouts. So, what are the underlying causes of palpitations in long COVID in general? Why do they happen in long COVID? Basically, in long COVID, there are three main causes of palpitations. There may be others that we don't know about as yet. Any one patient may have one or more of those causes, unfortunately. However, the causes that we do know about are, firstly, the damage caused by the SARS-CoV-2 virus infection at the outset to the cells, damage to those cells, direct damage to the heart muscle, the myocyte, leading to viral myocarditis. This is a frequent finding in patients with long COVID. The relevance of this is less well understood. So that's direct damage. Then there's dysfunction within the brain, more specifically the brain stem. Damage and disturbance of those brain stem nuclei. The nucleus ambiguous and the nucleus of the solitary tract. These are areas in the brain that control pulse and blood pressure. And if they're damaged, they can lead to rapid heart rate and palpitations, as well as overactivation of the sympathetic nervous system or withdrawal of the parasympathetic nervous system, as well as dysautonomia, as I explained earlier. So that's the direct effect, and then that's the effect on dysfunction because of effects on the brain. And then there's dysfunction of the immune system that affects the brain stem nuclei. So we're all familiar with the cytokine storm causing inflammation of those blood vessels, damage of the blood-brain barrier, passage of monocytes, so infection, so immune cells in the bloodstream, and also pro-inflammatory cytokines, those mediators of inflammation, into the brainstem nuclei. So then associated with all that, of course, is mast cell activation and, the hypothalamus, the brainstem, the limbic system, all within the brain itself are mast cell rich areas. And this results in further excessive inflammatory enhancement and hence dysfunction in those areas. And then finally, we'll have heard about the microthrombi, the mini clots formation, because, as we know, excessive inflammation leads to sticky blood, hypercoagulable state. MRI studies show mini blood clots in the brainstem area, in the brainstem nuclei. And finally, autoantibodies. Again, studies have shown that the existence of these autoantibodies to cardiac cells, also to neurological tissue, both in the brainstem, but also in the nerves that control the cardiac, the rate, and also the sinus atrial node. These autoantibodies can attack any of these areas and bring about dysfunction and hence palpitations. And so, those are the causes for palpitations in long COVID. It's important to know about those causes because it helps us understand the problem and hence accept the problem. And it also reminds us of the unknowns and complexities of long COVID, all the things that go wrong with long COVID. It's never going to be possible, hence, by just doing one thing to actually reverse long COVID. And more specifically in this case, the palpitations. And so, that concludes the first part of my talk on palpitations with long COVID. The symptoms, investigations, the diagnoses and causes. In the second part, I'll talk about the treatments and management and outcomes. I hope you found that helpful. Check out the references and the resources and links to social media in the show notes below, if you should so wish. As I mentioned at the start, any advice, diagnoses, treatments that I mention should only be considered after discussion with your own doctor or medically qualified health professional. So in the meantime, I wish you well for your long COVID recovery and hopefully see you in part 2. Cheerio.